As a student, you may hear things like get tested regularly or routine STI testing and be thinking, what does that mean? STI testing is the only way to know your STI status. Often, people won't experience symptoms with an STI, or symptoms are mild and are mistaken for other things. This means you can't determine your status simply by the way you look or feel. Knowing when to get STI testing is dependent on many factors. Testing may be necessary if someone is experiencing symptoms, has unprotected sex or their partner's status was unknown, is planning to have sex with a new partner, or if someone's partner experiences symptoms or has a positive STI status. If you are in one of these situations and/or are sexually active and it's been a year since your last STI test, talk with a healthcare provider at McKinley to know what STI testing is recommended for you. It's important to know that STIs have different testing windows, and some can be detected within several days, and others require weeks or months to be accurately detected. Let's walk through the steps to getting tested at McKinley Health Center. Step 1. Make an appointment. STI testing at McKinley is included in every student's health service fee. Make an appointment online through your My McKinley Student Health Portal or by calling. Step 2. Health history. At an STI testing appointment, a healthcare provider will ask a few questions about symptoms, types of sex you've had, and which safer sex methods were used or not used. Know that it's okay to talk open and honest about your sexual health with the healthcare provider. Step 3. Sample collection. Sample collection is usually quick and pain-free. A provider may swab their urethra, vagina, throat, anus, and/or collect a urine or blood sample to send to the lab for testing. Step 4. Results. Within a few days, a provider will send a secure, confidential message to your My McKinley Student Health Portal. Results may be shared in the message, or the message will ask you to call to speak with a healthcare provider to get results. Step 5. Treatment and retesting. If there is a positive STI test, a provider may direct the student to the McKinley pharmacy for medication that can cure or manage the STI and its symptoms. Remember, all STIs are treatable and some are curable. Testing is the first step to starting treatment or curing an STI. Retesting may be advised after several weeks or months to ensure treatment has worked. Step 6. Support and safer sex. McKinley is here to support you. McKinley's sexual health educator can help support you when talking to a partner about your STI status and/or with test results to discuss safer sex options. Also, be sure to stop by the Health Resource Center in the main lobby at McKinley to pick up safer sex supplies, including condoms, dental dams, and lube. Taking care of your sexual health is important, and STI testing is one of the many ways to do just that.